know. I'm yelling at dogs, looking at me like, hey, what did I do? I'm like, no, I'm not mad at you. I'm trying to suffer this. So it's been a week. Yeah, it's 30 seconds. Bobbleheads, yeah, just give me more money. I can make more money. Christy. I don't know. Oh, thanks. Yeah. My sister is Brian. Dad's still at Lower Kyle. Eddie, I think Ed. Yeah, I think he's still down. I just haven't seen him. How are we playing this? Yeah. Yeah, we texted a couple of times last year. Oh my God, it's already like November.
You know that Dina Bailey is
advice us. Or it was during the baby.
I say it's here for a long.
She got on me. Yes.
Much to my dismay, yes.
Oh, it's insane that they fight over these.
I knew she would. I knew she'd like
They
it.
have these
I'm a very
babies.
good
I've done my jobs. I knew she did. I loved it. I just couldn't show you.
You guys have someone else to fill it.
As soon as I get the approval, 3 people lined up, like interviewed and ready to go.
You have to be calm.
Sitting on the C-suite, say, it had
Oh, I said,
Yeah.
everywhere.
So big.
You guys are in your survey window, right?
So I said, I have to be opportunity, so we don't have to. Just keep
Well, maybe there.
saying it's a number. I'm like, oh my God, we've created.
Yeah, it's just one day after another. It's just a laugh a minute.
Town. She takes me.
How's your guys' staff been doing? You guys don't know how to keep people?
In a program.
Yeah, she was out.
This is our first
I'm
time that
sorry.
we're.
The trauma gods, I'm sorry. No, I think we're, and she only, she was unhappy. She just wanted to teach and
So the personality.
and the school, this particular disability. Like a full on year now. Bethany sucked her hand and was able to, she got ready on hers. And it was like,
And that one was written. This was in a call.
Oh, she's
Happy. Yeah.
Just
she
like,
seems to be.
this is the first time we've ever been like since I've taken over.
We'll
Oh.
always have to put in hospital settings.
Fortunately, got it.
All right, I have 1:31 on the clock, so we'll go ahead and get started to the Regional Trauma Advisory Board meeting. It's today, January 21st, 2026. I'd just like to start with a roll call.
Okay, Dr. Fisher,
Present.
Dr. Cools. Oh, she snuck in. Lisa Rogie, John Pope,
Present.
Dr. Dort, Ashley Toller, Dr. Morgan, Keith Barry, John Resicar, Danita Cohen. Is she online? Okay. Sam Scheller, Aaron Breen, Chris G. That's Aaron, I think. Are you there, Aaron?
Yes.
Okay. Dina Bailey is online, yes?
Yes.
There she is. Amy Henley? Alexis Musey? Ryan Tyler? Maya Holmes? And Jessica Colvin.
Here.
You do have quorum.
Excellent, thank you. So we're opening up now to the first public comment as the period devoted to comments by the general public about those items appearing on the agenda. Comments will be limited to 5 minutes per speaker. please clearly state your name and spell your last name for the record. If any member of the board wishes to extend the length of a presentation, this may be done by the chair of the board by majority vote. There will be two public comment periods. To submit public comment on either public comment period on individual agenda items or for general public comments. Do we have any public comments at this time? Very good. Item number 3 is adoption of the January 21st, 2026 agenda. Anyone wish to make any additions or subtractions from this agenda?
Second.
All in favor? All right,
Aye.
very good. The consent agenda today just includes approval of the minutes from the RTAB meeting October 15th, 2025. Like a motion to approve those minutes.
Second.
Okay. All in favor?
Aye.
All right. Item number 5 is a report from our district health officer. Okay. All right, well, moving right along. Item number 6, the nomination election for chair and vice chair of the RTEM to begin their appointment as of today. The candidates are here. So myself and Dr. Cools have both been nominated. Information about both candidates has been provided to you. Second,
Second.
okay. Can we have affirmative votes for Dr. Cools?
Aye.
We're recording a total.
Hi, this is Shonatello with
That's why I'm
number.
hesitating, because I know you're gonna ask for a roll call.
Yeah. Okay, let's do a roll call.
You don't have to, it sounded like.
Yeah, just so we can have everything official on the record. I'm gonna abstain since I on the other nomination.
Sarugi. John Pope. Stuart.
Aye.
Ashley Toller. Yes. Dr. Morgan is not here. Colonel Barry, are you abstaining? Thomas, are you abstaining as well? Okay. Danita Cohen.
This is Shonatello and for Danita Cohen, but I was not able to hear the vote.
Or should nominate Dr. Cools.
Yes, I'm voting for Dr. Cole. Thank you.
Sam Scheller, not here. Eric Breen.
Aye.
Chris G.
Aye.
Dina Bailey.
Aye.
Amy Henley.
Aye. Sorry, I
Alexis-
just joined late, but I know what you were asking.
Okay, thank you. Alexis Musi. Brian Tyler. Maya Holmes.
Aye.
Jessica Colvin.
Aye.
We have 12 votes aye, 1 vote no, and 3 abstains.
In the interest of time and mathematics, I believe we can elect Dr. Cools for the next RTAB chairman. Is that correct? Am I right? Okay. All right. Very good. Moving along. At this point, we'll do the nominations for vice chair. And then I turn it over to Dr. Coles. Is that correct? Very good. All right. So we have two candidates, John Pope and Dr. Dort. Why don't, motion to nominate or, motion to elect, John Pope. To Paul.
Is that sorry, Mr. Chair, is that a motion?
Yes.
Okay. We need a
I
second.
need a second.
Yeah.
Second. So the motion to, a motion. All right.
I'll second.
So we, since we have a motion and a second and not on the first candidate, can we just proceed with them? Dr. Dort?
Yeah, we can
Is it
proceed
like
on
that?
the pending motion.
Okay. All right, Dr. Dort, congratulations. Vice Chair Artab.
No,
Yes or no?
sorry.
Just go with the vote.
Yes.
Okay, absolutely. All right. Yes. Yes.
Ashley Tolar. Yes. Dick Cohen. Shauna Tello.
Aye.
Aaron Breen.
You guys, I'm sorry, I can't hear. What am I voting on?
For Dr. Dort, Chair.
Aye.
Dina Bailey.
Aye.
Amy Henley.
Aye.
Ryan Tyler. Maya Holmes.
Aye.
Jessica Colvin.
Aye.
Thirteen, 14 ayes and 2 abstaining.
All right, then who, the new elected chair and vice chair, Dr. Deborah Cools and Dr. Sean Dort. At this time, I'd like to thank you all for having served on as RTAB chair for the last 2 years. And I will happily pass the mic to you, Dr. Cools. Take over the remainder of the meeting.
Say that particularly this meeting, I step out of line or don't follow along. So as I see, the next item on the agenda is 6B, which is discussion of upcoming nominations for non-standing RTAB member seats for the term expiring June 30, 2026. Stacey.
Yeah, because there's a little bit of edits to this one. So we do have our next seats up for nomination for our non-standing members. That term does expire the end of June. So we have general public, health education, legislative issues, employers and medical benefits, and public relations and media. On your nomination forms that are in your packet, it does say that the deadline to submit those is March 31st. I am going to please ask that we move that up to the end of February 28th, because historically we have had nominating committee right before the next RTAB meeting with April, but our bylaws do state that we will hold nominating meeting and no later than the end of March. So I'm going to ask that we please have those nomination in by February 28th, and then ask you all that we schedule a meeting for March instead of April, just for nominating committee, not for the next RTAB.
And do you know how we'll establish that March date?
I can send out a doodle poll. We do already have our pre-TMAC meeting on March 18th. So if everyone is available on March 18th. I was gonna suggest that day. We do not have to do it in person. We can do it via, a virtual meeting. So, but if that date does not work for you guys, I am more than happy to send out some dates. Everyone gets the most votes.
Clarify that. So does this turn on automatically? Different. Good Lord.
Yes.
Served here. So the 28th, you're asking us to change the nomination time. And then March 18th would be then no, when would you do the nominating committee? That's okay.
Okay.
What time are you thinking? This time or?
We could do this time.
It is right in the middle of spring break.
You're right.
How about I just take like 3-4 days and I'll send it out. I will not
Good call.
Point.
Okay, so then we will expect to do the.
Yes.
Thank you. Next is item number 6C, discussion regarding bike e-scooter statistics from each trauma center. And this is assigned to the chair.
Sure. So we compiled with some data from our facility regarding the volume. We had for 2025, 254 patients, approximately a third of which were pediatric. Most common injury was traumatic brain injury, and particularly in the adults and the kids, unfortunately. We had a 21% documented helmet use for those patients. And that doesn't relate whether the helmet was even adequate for the speeds they were traveling. As you know, simple bicycle helmets only protect you up to about 18 miles an hour, which many of these vehicles can exceed. About 1/5 of our patients had TBI that had those. So these are some of our sickest patients, 8% of which were full tier activations, 46% were level 2 activations. The majority of the injuries were related to losing control of the e-bike or e-scooter by the rider, rather than someone being hit by it. And we also had our admissions. I'm sorry, I don't have that. I think we had on the last one, the admissions, John.
Admissions is about 33%.
Yeah. So we have all the full data numbers. We're happy to share with the health district to bring them forward, compare with the other trauma centers, see what they're seeing. I have met with chief representatives from Metro and from Henderson Police and from EMS and Clark County District to discuss the issue with those. There are laws in place regarding the e-scooters, which our law enforcement have discussed with us, such as that they're supposed to ride in the bike lane, that there are certain vehicles, such as those scooters that don't have, or the e-bikes that don't have pedals, are illegal to ride on the road. And if they're riding on the sidewalk, it has to be less than 15 miles an hour. So how, the enforcement obviously is up to law enforcement. From a health district perspective, I think we have to hammer home, helmet use, safe riding, learning the sort of the laws that apply to riders, educating them with those, and then educating helmet use, how to use a helmet, and what helmets are adequate for those people that are riding. There is no, there's no age limit to who can ride what. So that is something that we may have to discuss with parents. It'll be a lot of community outreach through all the trauma centers of various education and outreach directors, I think, to get some of that across. but this definitely become a very hot topic with the field of trauma and with the ACS. So this is our data. I'd love to see the other centers present something more. I think there's the shared data may be publish worthy as experiences with, a region's experience with e-bike and e-scooter crashes. We've really been hammering home to, the residency attendings to try and get accurate information on where they were wearing a helmet, what kind of vehicle was it, and so forth, so we can better and more accurately document our data and make sure that data is clean. But I think there's some opportunities here, and certainly with Ms. Breen as well within the legislature to see what we can do to make this safer for these riders and for those that are also affected with it. We've had a few where we've had scooters versus pedestrians, that kind of thing, and how to make it safer for everyone. Oh yes, we've had deaths, fortunately, from this. I think what we had like 3 peds and 8 adults.
Pretty close.
Yeah. Yeah.
Would it be appropriate for me to jump in here on top of Dr. Fisher's great report? Just talk about this a little more since we're already discussing this?
It's Aaron.
It is Aaron, I'm sorry. I'm sorry.
Yeah.
We knew.
Obviously, this is an issue in every single jurisdiction. And the good news is that there's a lot of work happening on this topic. I think that this is a great opportunity for the trauma system to be available as the trauma system to talk about this topic. So, I've been looking at these crashes for a couple months shy of 30 years. We've never had a year like 2025, never. So we lost at least 3 children on e-scooters, 1 child on a Razor scooter, 1 child on an e-bike at least, and 1 child on a regular bike. So, and then the number of children that are being hit to and from school, I think, I don't know, we're up to, last I heard, close to 230 kids on their way to and from school have been hit this year. Scooters and bikes play a role in that. The biggest role is the driver and the kids being hit on their way to and from school. Half of those fatals were the child's fault. Maybe more than half, which is unusual. So anyway, it's a hot topic. There is a lot happening. Well, I'll go ahead and talk about it now. I was going to talk about it under legislature. So as you all know, we just we had a special session of the legislature. There were 8 items originally suggested for childhood safety. One of them that the governor felt that it needed the full session, that special session was not the time to bring it forward, had to do with e-bikes and e-scooters. And what was suggested was that you have to have at least a learner's permit to operate an e-bike or a class 3 e-bike or an e-scooter, meaning that the child would have some, we hope, semblance of the laws of the road. So that's going to be visited for the 2027 session. And that's something, like Dr. Fisher said, that this is happening across the United States. I don't know if anybody's has as bad an issue as we do. Part of it is our streets, part of it is great weather. I mean, lots of things contribute to that, but I think we could be a leader throughout the United States in this area. And I think it's a great opportunity for the trauma board to step forward as the trauma board.
Thank you,
End of
Erin.
speech.
Can everyone hear me, including
Yes.
the online people? Okay, sorry, my mic wasn't working. Thank you for that. Also wanted to, if I could just make a comment, and then I think this is really great work. It is really a public health issue, and one that really begs good intervention, in addition to what's already been done. I think in the last RTAB meeting, you gave a preliminary report and we all agreed that it was a very timely issue. I think I would really welcome us collaborating as a trauma system. And what would be necessary is the actual data points that to share them, and then the various trauma coordinators, program directors could work on data. We would need an IRB to do this. And I think Sunrise, I think I mentioned this in the last meetings, I believe they defer to UNLV. So, you know, we could do an IRB, St. Rose, and I don't know if Michael Callahan can participate or not, but we can look at those hurdles. There are publications, but they tend to be single trauma center publications. So I think this is a great thing to go forward. And some action steps would be perhaps just a list of actual variables in the trauma database. And we did this for calendar year 2025.
Correct.
Okay. I know we're still finalizing our numbers. I just wanted to echo in, we pulled some preliminary numbers a couple of months ago, and in looking at trends, there were certain segments that had increased by 400% in the last 3 years. So I think, you know, this is timely, and perhaps I could ask that we talk offline and really get the ball rolling with this as a multi-institutional study.
Yeah, absolutely. I think that's a fantastic idea. We're more than happy to bring it through our IRB. Look at the calendar data as a region definitely makes a stronger paper for publication. And then we're happy to share that with you. It would also represent kind of maybe the first collaborative Southern Nevada Health District research paper published through, which I think would be a real milestone for this group. So I think that would be fantastic. And then what plans that we look at on the outreach side from from both Erin's work and as well from the individual trauma centers, and how we do that to improve. And yeah, I'm excited about it. I think we can really do something great here. So we'll bring it back to our research coordinator and try and kind of push this through our IRB and be ready to share that data with you.
Okay, that sounds good. So why don't you and I be in touch as the
Absolutely.
next steps?
First, Dr. Fisher, thanks for bringing this up 2 months ago, I guess it was, even,
Yeah.
right? So timely. And I was hoping they'd do more because they had a stupid special session that I didn't need, but I'm glad they didn't do a knee jerk, because we do need information to gather to do the right changes that need to come in. There's an education component. As a retired teacher, when we got rid of driver's ed, we have people that don't understand the rules of the road, let alone that a bicycle in Nevada is, since its inception, has been defined as a vehicle. And people don't even realize regular everyday bikes are not supposed to be on the sidewalk. There are certain standards that they're supposed to do. So I think as you do within the trauma world, I would like to work with Erin as a public representative and see if we could do some community town halls maybe, because you're going to have to educate the parents, the schools, everybody with regard. I'd like to hear from our first responders, because they're going to be the ones that are also the initial people on site. I watch them go through four-way stops on my street every day. And it's just, and you're driving a vehicle. I don't care how fast it's going. It's just insane what's happening out there. So I think I want to look, I'll be happy, Erin, to look at best practices that are out there. Maybe we involve, the county has a traffic director now called Mr. Bennett, and maybe we can work with him on see what's out there in other states. I don't believe this is something that is cookie cutter. It can be duplicated, but we need to figure out what works best in Nevada. The helmets, the age restriction, because mopeds and scooters were only added about years ago, I think, as far as statute, where they have to have a driver's license and so forth. Age restrictions, I watched 5-year-olds on 35 mile an hour, literally going down Oki the other day, and I was like, where are your parents? You know, what are you thinking? And I know it's a convenient way and a cheaper way of a mode of traffic, so we have to acknowledge that, but there needs to be responsibility that goes with it, so we're not having the wind up in the trauma centers. So 18 miles per hour is what a simple helmet.
Yeah, just basic bikes helmet.
If you have any ideas of states or places or hospitals that or trauma systems that are weighed in, let me know and I'll do some additional research. If there's people out there that we can look at for best practices.
There are.
Are there? Okay.
Yes.
And so Aaron, I would offer to work with you and coordinate some of this. But the school district's actually doing town halls over the next 2 months. So I'm going to one, but I may suggest to the trustees that they add this as a discussion item potentially, because they're looking at how the school district functions
Absolutely.
with the new superintendent, but it might be a way to plug in that conversation. People
So this,
react. Yeah, people will overreact. I don't want to do it to people. I want to find a way where we can embrace it and say, this is a community safety issue, and we're trying not to restrict your right to be able to drive an e-bike. We want to make sure that it's safe, coordinated. Drivers know how to handle you, let alone you know how to handle yourselves. So I think that maybe over the next month or two, we could maybe take a look at that. Now, for my edification, what is an IRB? I know the term someplace in my brain, but
It's an institutional review board. And they.
within your system then.
Yes, yeah. Anytime you engage human subjects, even retroactively, that it's advised to go through the institutional review board, and there are times when individual IRBs will defer to other IRBs. And I know that Sunrise, I believe, I've been told, defers to UNLV. And, you know, so I can kind of research that end of it, because I think we would want that before we publish
Yeah, for sure.
information.
Thank you.
The other point that I wanted to make, you know, all of our trauma registries are great, and this is really great. What is not captured in the trauma registries are, number one, people who go to other hospitals, right? Non-trauma centers, and then deaths at the scene are not captured. So I have some access to the death reporting system. So I'll take that on to see how we can capture that information as well. The other possibility would be, I know we're thinking of this in terms of our regional trauma advisory board, but there's really only one other trauma center in the state, and that is Renown. And particularly if we want the data to kind of be leveraged for legislative action, I can certainly talk to Dr. Gomez from Renown and see if they would be willing to collaborate if everyone thinks that is okay.
Yeah, absolutely.
Dr. Close, can I also add that Jorge, who is the trauma prevention person for Renown, he's very interested in this as well. I was going to suggest that maybe for looking at children, that we also add pedestrians into this conversation, because that would then bring in Washoe County, Carson City, that area. Thankfully, they haven't had this problem they haven't lost children on scooters or bikes. I'm sure that they've had them hit, but I am in touch with him on this very subject. So I can make sure that Jorge is looped in as well.
He's great.
That sounds good. From Renown, is that correct?
Yes.
Okay. I think that's good. I think we would want to make it straightforward so we could really get this off the ground But I
If
think
I'm-
it's huge.
If I may really quick, I just want everybody to be aware, there is legislation that just recently came out as ACR 4, and it directs the Joint Interim Standing Committee on the Judiciary to conduct a study on road safety. And it may not specifically state they need trauma data, but as stakeholders, I think it would be important for us to work with Senator Schweibel on providing some of that information.
And Dr. Coles, just so you're aware, I do already get all of the on-scene deaths for the TMAC reports. So I could go through those and see if they're that much detail for e-scooter, e-bikes. I don't know if they go into that much detail, but we do already have some of that data.
That would be great.
How difficult would it be if you both decide that you need to add X, Y, and Z for tracking? How does that happen?
So the trauma registry you're speaking of, there are customizable fields. I'll defer to people who know a little bit more about it than I do.
I think it would depend on what kind of data marker you're wanting to add in there. Some of them are going to be a little bit more easy to add because we can find them off like the EMS run sheet, but some of them are going to be so non-specific that it's going to be not worth the time.
But the death component could possibly be something that death on scene.
We already track that. The death, yeah.
Death on scene, we
No. Oh,
don't
the
get
death
that
on scene.
information.
So we already tracked deaths that come to the trauma center. Death on scene would be something we could pull from a separate
What
report.
Stacy has.
All registries are focused on certain codes. And so what we could do is focus on those certain codes. That would be the way to make it similar across the board.
That everybody's gathering the same.
Right.
Those numbers won't be huge because we don't do a lot of declaration in the field on trauma for death, but it's certainly worth looking for because even a small number could make a big difference in our statistics.
Right, and particularly with children, I think
Yeah.
kind of the emotional aspect of legislative actions. When you look at children, of course, you're looking at a lot of years of life lost and all sorts of other, I think really important and emotional aspects as well. And I think it's important that we do that. And I'll just make a comment that on firearm injuries, which continue to be one of the leading causes of death due to trauma, we as trauma centers actually didn't realize what a significant role they played in trauma because there are so many deaths at the scene that when we looked at the patients coming to the trauma centers, it really underrepresented, if you will, the public health issues. Thank you. Great discussion. Next is item 6D as in dog, and it's renewal of authorization of Michael O'Callahan Military Medical Center as a level 3 trauma center. And I'm going to need a little bit of direction. Is there discussion or is it just strictly a motion?
To approve.
The application is in the packet, yes.
Application is in the packet, and then so we would just do, correct me if I'm wrong, discussion on the item if there is any, and then a motion.
Motion to approve.
Yes, discussion next. Thank you.
I got something email a month or so when I'm trying to find it. With regard to fill out this survey with regard, I thought it was for this one. Trauma piece, which was just seemed awkward to me as a member of this board to respond to a survey about whether they should qualify when I hadn't even had a presentation yet. It's not, it's another one coming up. Okay. But when would I get information? Because I felt silly answering because they really wasn't that familiar.
Are you speaking of the results of that survey? Or are you speaking of
Getting the
information
survey,
on
let
this?
alone, I was just like,
Okay.
being asked this. I don't know enough about what this.
So my understanding is the results of the survey are not yet finalized. Is that correct? They're not included on today's agenda.
Okay, it found it, Stacy. It was from November 20th. Road St. Rose Sienna Hospital. I applied. And then I do the survey, but I'm like, why would I respond to the survey before I've even had been offered any information?
That's when we offered information. We were told we should ask people what they think first. So that we did it this way, the way the board directed last time we did this. I apologize if it was confusing, but or the survey is for the RTAB for provider agencies and the hospitals to determine what impact they have on those things. If there were none for you, then there were none for you.
Yeah, it wouldn't necessarily fit many of the role of these us serving on our.
But if I didn't ask you, I could yell.
Appropriate in my-
Well, John, I think there was a distinction though between asking the other hospital systems versus asking RTAB members.
Yeah, I think it's important.
Well, I do share.
We're getting out of.
Madam Chair.
Yes.
Yeah, I would,
It's,
yeah,
I
I
recognize that. Yes.
apologize. Yeah, I was just going to say that this is off the agendized item and might be appropriate for a discussion at a different time. Yeah.
At a future meeting. So what is before us is the renewal of authorization of Michael O'Callahan Military Medical Center as a level 3 trauma center. So again, did I hear a motion? Okay. Okay.
Yes.
Okay. And second, and then do we take a vote then?
Madam Chair, yeah, you would open it up for discussion and
I
when.
think we did. That's when this came up. Is there
And-
any other discussion? Okay. No. Okay, hearing none, then I think we would take a vote. And so let's,
Can you just ask all in favor?
all in favor, say aye.
Aye.
If there are any that oppose, please speak up. And if there are any that want to abstain, please indicate so verbally.
Abstain.
So what I heard is everyone agreed except 2 members who are abstaining. Yep, the motion carries. Thank you. Next is item number 7, the Regional Trauma Coordinator Report. There's information in your packet, and I'll just read them off. The first is an update for EMS and trauma system. Is there any comments from our staff?
I do have a couple quickly, so I just want to I think you guys have all probably already been introduced in one way or another to Kristen, but Kristen is our new Nicole. So she is down there learning with Laura. So you will start seeing emails from her and communications from Kristen. So please welcome her to the team.
Welcome.
Would you like to say anything?
to be here?
The only other thing under this that I wanted to bring forward briefly is if you guys remember a couple of years ago, we used to have TMAC before RTAB, and then we flopped them for reasons that made sense at the time. However, I would like to propose that we flop those back because any action or anything that is done in TMAC right now has to wait 3 months to go to RTAB. So with the meeting being after RTAB, anything we do in the next meeting isn't going to get solution until the next RTAB meeting. So if there's no major objections to that, I would like to switch the times back again.
I need direction. Is there?
So can I make a motion to do that? Because I would agree that just having been here forever, that if nothing else, this meeting is much more likely to run over an hour than the other meeting. And for logistics reasons alone, I think that's a good idea.
Madam Chair.
Didn't we switch it though for that reason? For like, cause remember we were running the TMAC was finishing at like 2 o'clock and then we had to wait till 2:30 to start the RTAB because it's a public notice meeting.
Right, but then the RTAB would go 2 hours.
That's why we flipped it in the first place. Cause like TMAC would finish at like 2 p.m. and then we couldn't move up the time on RTAB
Right.
because it's a publicly noticed meeting.
But for the reason you stated and for, I think, a lot of these meetings we've all been to have gone way over an hour. So
I think I may have done it wrong.
Do we, as a matter of order, do we need to take a motion for this? Is this allowed on a?
No, this is a non-action item, information only, so we wouldn't be able to take action on.
I'm gonna get scolded now. So we can't vote on it till next meeting. Agendaize it next in April
or
and then vote on it?
Do it.
I thought we could.
Actually, you can get the temperature of the room and see what the board believes.
Because I don't remember voting on this last time.
Yeah, can we do that?
This is a non-agendized action item, and so we can't take action on it per se. But I think
We can be
With
advised by the discussion.
Yeah.
Is that okay? That's
Oh,
probably.
yeah, I would have to look at past action that resulted in that decision being done. And so it might require an official vote, it might not. So let me get with the team offline and we'll get a resolution.
See, now look, I'm the one causing trouble. Welcome.
Well, I'm likely to step out of bounds a few times, especially on this meeting. But so just let me know, okay?
Okay, sorry, I'll
No,
give you an
no worries,
update.
no worries. Okay.
Sorry,
next-
Ed.
Next agenda item is item number 7B as in boy, trauma field triage criteria, data reports for the third quarter. Again, I'll defer to staff.
Yep, were all sent out and they are also in your packets. I'm happy to answer any questions or open any discussion on that. While you guys are looking those over, just so that everyone is aware, we have fully transitioned over to the TFTC reporting. And I feel like that's going really well, unless the centers have any opposite feedback for me or any suggestions or anything that you would like to see with that, but I think it's going well. July. Yeah.
Is there any further discussion? Otherwise, thank you for the information.
Of course, unless anybody has any questions on the reports or any discussion or input on that, that's it for me.
Any discussion? Otherwise, let's move on to the next agenda item. And I need some guidance. I don't believe Dr. Morgan is here.
She's no longer on.
Okay, so
Just proceed.
just proceed without that. So we will skip item number C. Agenda item number 8, information items, discussion only, and we have a number of reports. The first is report from Public Provider of Advanced Emergency Care. Ryan Tyler.
Hi, my name is Ryan Tyler, Clark County Fire Department. The only thing that I'd like to mention is that the Clark County Fire Department has successfully administered pre-hospital whole blood, and it has been going really well. Not in a position to share any statistics or data, just to let you know that it's gone really well.
Thank you very much. And that is a significant contribution. Thank you. Next is report from private franchise provider of advanced emergency care. Sam Scheller.
Hi, Sam here. I have no report.
Report from general public representative, Chris, and I always stumble over your last name. Yes, thank you.
The only thing is, because of the special session, I did contact Mr. Bennett from the county as well as Aaron and some legislators about seeing whether or not the governor was going to move something forward other than the DUI component. This was not the e-bike, e-scooter thing was not going to be on the agenda. So I will now work to do some public outreach so that we have to complement whatever you're doing on your statistics.
Okay, thank you. Next is report from a non-trauma center hospital representative, Alexis Musi.
I don't think she's on.
Not on, okay. Report from rehabilitation representative, Amy Henley.
Hi, I don't have anything to report, which is good because then there's nothing negative to report.
Okay, thank you. And let's see, report from Health Education and Prevention Service Representative. Yvonne Ramos, I think, is being replaced by Dina, right? Dina, are you on the line still?
Yes.
Okay. Do you have a report, Dina?
Can you hear me?
Now we can.
I'm sorry. Yes, I have nothing to report.
Thank you. Next is report from Legislative Advocacy Representative. Erin, I believe you already gave your report. Is that correct?
Partially, I have a couple little things from special sessions that I also wanted to just make everybody aware of in case they're not. In the special session, AB 6, which has to do with school zones, was passed. School zones, each entity, so Clark County, City of Las Vegas, City of Henderson, etc., they will each have the ability now to determine how long their school flashers will be on, so how long that 15-mile-an-hour zone will be in effect, and how long the zone itself is, which is something that is really near and dear to my heart. The reality is that we protect children right now being dropped off in front of school. If you go more than 100 yards from the front of the school, it's no longer a school zone. So we're not protecting kids in neighborhoods. So it's a push that I would love to see this body get behind. Extending school zones. So now that's possible because of AB 6 and the fact that we have an awful lot of kids that rely on school for breakfast in the morning. So if they don't get there until a half an hour before school, in lots of cases, they miss out on breakfast. So extending that zone to an hour before school and probably an hour after, and then extending the zone itself will now be possible, as well as also under AB 6. We always thought that this was law, but it's not. But it will become July 1st. All fines in an active school zone will in fact be doubled. So that is the monetary fine. It is the fine of, things are a little crazy with how we do things these days, but points on your license and everything is doubled now in an active school zone, trying to get people to pay closer attention. And then the other thing that affects this board was AB 7. And AB 7 is stronger penalties for people who are driving impaired. And I think that's going to sort itself out a little bit, but especially for someone who has been charged with DUI and convicted more than once, the penalties are going to be not hugely greater, but greater now under AB 7. So, and then you heard already that there'll be a study done in the interim that we hope will eventually lead to some kind of approval on safety cameras. And that's it.
Okay, thank you. Next is item number 8, report from Public Relations Media Representative. And Danita Cohen is not present. I don't know if Shauna Tello is still present online.
I am Dr. Coles.
Yes.
Very brief update on behalf of UMC. UMC has done a lot of media outreach on the dangers of scooters, the topic that was discussed earlier at this meeting. And we've had a lot of success with the news stations picking up the stories and communicating the importance of helmet use and the lights and bells and all the different interventions that can be used to keep everyone safe on those types of vehicles. And so we're very happy about some of the media coverage and education that's been provided. And so that concludes my report. Thank you.
Thank you. And last item under this agenda item is report from System Finance Funding. Jessica Colvin.
Nothing to report.
Dr. Coles, you also had me as payer, but no report.
Oh, I'm so sorry. I've a report from payer of medical benefits, Maya Holmes, my apologies. So, and then that brings us up to agenda item number Roman numeral number 9, second public comment. Is there anything online? Okay. Anyone present physically? Okay. Next is adjournment, and I believe I need a motion to adjourn. Motion. Okay. All right. Thank you. Thank you, everyone.
Thank you.
See you
Bye.
soon.
Thank you.
Bye.
I can just say adjourn.
Did you call for something?